We have made a number of decisions. There's a number of draft of resolutions and decisions that are going to get adopted later today when the plenary meets in its 6th meeting and is going to adopt a number of the reports that have come out of the committees, Committee A and Committee B of the World Health Assembly. I'm not going to list them all. You can find that in our journal, which we post every day, but obviously I'm open to questions that you might have. Some of the more important points that we have looked at this year and that are pertinent to today's overall theme is we have had a resolution on Ukraine. We've had a resolution on the occupied Palestinian territories, including East Jerusalem and the occupied Syrian Golan, and another one which is a continuing reporting requirement on the health situation in the occupied Palestinian territories, and including East Jerusalem. We had a vote each time, but each time the resolution passed. Today, what's on the program currently going on is global health architecture. The item was started yesterday in Committee B. Discussions are still ongoing, but so far it is looking very positive. Overwhelming support from member states for a new process that has been designed to look at reform for the current global health architecture in a very consultative and very broad and inclusive way, including not only member states and other global health institutions, but also much broader, including civil society, non-state actors, as needed, so that really every voice is heard. So this very ambitious process hopefully will get adopted today, and we will then immediately move into implementation phase. There's a very ambitious timeline for reporting back to the next World Health Assembly in May 2027 on the progress made and on the implementation, full implementation of the process. So a lot of work ahead. Another item that is coming up today is in plenary. Later this afternoon, it starts at 5 p.m. It is the election of the officers of the executive board. And on this, our procedures provide that the general committee, which is a smaller committee consisting of 28 members, counting the chair, they have met on Wednesday, and they have drawn a list of 10 members for 10 vacant seats. So we expect this to go smoothly as well tonight in plenary, because we have an equal number of members and vacant seats. So this is the update. And then if everything goes according to plan, tomorrow it will be just the final adoption of all the reports and the closing of the World Health Assembly. If we have some items left over, they are likely to be technical items from Committee A. If Committee A does not manage to finish, then there's a likelihood that 1 or 2 items might still be taken tomorrow morning, because when we meet in plenary tonight for the election of the EB members, the committees cannot meet at the same time. So that is it from my update, and I'm open to your questions. Thank you so much.
Thank you very much, Sigrid. Okay, we'll start with any questions in the room. We have one online from Agnes, AFP. Agnes.
Yes, hi, good morning. Just some quick questions. I would like to know when the withdrawal of Argentina will be discussed, at what time exactly. And then as you were beginning to speak, there was Dr. Tedros beginning his statement at exactly the same moment, so I couldn't be able to follow it on the reform. So I would really appreciate if you could share with us his statements. Thank you.
Yeah, for the statement, there shouldn't be a problem, Hannes, we will get it.
In any case, all his statements are usually posted, right? So I missed it as well, I'm sorry to say, but I'm sure it would have been an inspiring statement in support of this very important initiative, not just for WHO, but for the whole world. Your question on, there is indeed a draft resolution on the table concerning a request made by Argentina. to denounce the constitution. I know some people refer to it as withdrawal, but it's really not what it is. So it's to denounce the constitution. It is scheduled for today. Normally, it could come up anytime this afternoon before 5 p.m. because at 5 p.m. we have the hard stop for the plenary. I don't expect any delays, so it should come up. I would expect between 2:30 and 5 p.m. I cannot give you any more than that because it really depends on how the next agenda item goes. Normally, the next agenda item is item 15, and that has several sub-items, so it will depend on progress. There are two amendments proposed to the draft resolution that is on the table. One is very much a reiteration of the draft resolution that is already there, and the other one is different, has some deviations that are being proposed. All of them are posted already and have been posted for a while, at least a week, I think. And the World Health Assembly will look at them and then deliberate whether they want to decide on any of them or whether they don't want to decide on any of them, or whether they don't want, or they are free to say they want to do something else entirely different. So we will see. It will be an exciting meeting. We've been looking forward to it for a long time. So hopefully everything will go well this afternoon, and I hope that addresses your question.
Sure. Christian.
Could you just, for those who haven't studied all those documents that have been online, could you just remind us of what the amendment?
So the draft resolution that was proposed to the Executive Board in January and that the Executive Board submitted to the World Health Assembly is actually saying that for the WHA, I don't have it in front of me, so I'm trying to get the correct wording, for the WHA to agree to the denunciation and to accept the denunciation of the Constitution, which effectively is what is meant by withdrawal. I should say in this context that I don't like to use the word withdrawal because it's legally not correct. WHO is not a club. It's not a social club. You don't withdraw your membership. You don't stop your membership. It's an organization, same as the United Nations, created with a constitution for the United Nations. We have the charter with the principle of universality in mind. It can only work if it has a universal mandate. And a universal mandate means that all countries in this world should be part of it to the extent possible, obviously. And therefore, there is no need for anyone who accepts the WHO constitution to withdraw from it, because you do not give up any part of your sovereignty when you accept the WHO constitution. You just accept it, and then that remains. And if you stop engaging, if you stop working, that is the prerogative of a sovereign state. You can do that anytime. And therefore, there is no real need for the World Health Assembly to pronounce itself on the request that has been received. It can, but it does not have to, because it's a unilateral act that can be done anytime by a sovereign state to stop engagement, and there's no one that can stop them. So that is already the case. If they do decide on something, there is another resolution that will be going in the direction of emphasizing the wish for continued cooperation in the near future, for resuming a good relationship and fruitful collaboration for the Health for All goal that all the countries have. There is also some proposals that might go further, but they have not been put in writing, which actually also talk about continued cooperation regardless of whether the member state is wishing to engage. So if ever they need help, we've just seen an example with hantavirus, that it can hit anywhere, anytime. And if any support is required, WHO is there to support. And WHO has been working with Argentina on hantavirus very closely. So that is the situation. So it's not completely opposite resolutions. As I said, it's just an amendment that is being proposed. The other amendment is just insisting, I think, on the same points already made, that it's the sovereign right of a state to denounce the constitution. And I'm not disputing that. I'm just saying there is absolutely no need to do anything like that, and even less need for the World Health Assembly to say anything about it, because if a country decides so, it's decided. So they don't need anyone's authorization. That's my point, I think. I hope that may address the question. And I do hope that in the spirit of collaboration for a very, very important goal, member states will maybe come to an agreement and be able to say, and we will continue collaborating when the time is right.
Thank you so much. Okay, we have a question now from Satoko Vyomiri online. Satoko.
Hi, hello. Can you hear me?
Yes, we can.
Great, thank you. I have a question on the withdrawal of the membership of the United States. When will this issue will be discussed, and which committee will discuss the United States withdrawal? Thank you.
Thank you. There is actually no agenda item specifically foreseen to have such a discussion, because nobody has requested it. No member state has requested it, and the United States have not made any request in that sense either. So normally I do not expect any discussion on that issue. Obviously, in the related agenda item 20.2, where the resolution, the draft resolution concerning Argentina is on the table, a member state could raise it, but honestly, I do not expect it. There is nothing to be said.
Okay, well noted. Do we have further questions for Sigrid? Yes, John. Nice to see you, John.
Thank you. John Halpern, Arret News. I'm just wondering, as somebody who oversees the planning and execution of the organizations in various capacities, this whole general theme of government stepping back from multilateral institutions, health institutions, while still depending on the surveillance and coordination and emergency response systems that the institutions provide. Would you consider that to be sort of an overriding major theme, or is that percolating in the background? To what extent do you think that's affecting the overall assembly this year? Thank you.
Thank you. It's definitely something that has to be thought about, and member states are considering. Multilateralism can only work when it's multilateral, and if some member states choose to just have some benefits but no longer cooperate in any other way, other member states might see this as a problematic situation, and in particular if it persists. If anything, I think some of these decisions are bringing member states together. When sometimes we have difficult discussions in the room, I think member states are drawing together on very important overall principles. And I think this is a good development. I have heard a lot this week from member states from all corners, cross-regional, about universality of the mandate, about standing together, and about being mindful that this World Health Assembly, like any other World Health Assembly, is uppermost about health and not about some political issues that are out there. And that it's very important to bring all the work of the organization, and that includes the work in the executive board or in the administrative committee, back to health issues, and really concentrate and prioritize health issues and not be sidetracked by the overall geopolitical context. I think the initiative on the global health architecture is a right step in that direction, because it's going to take us there. It's going to take us at looking at what does it take to stop fragmentation? What does it take to work together in one combined effort, bringing everyone to the table? And I think if we can achieve that, then I think multilateralism is going to have come a long step further. And I think that's what this is all about.
Absolutely. Thank you so much. I think that does it for questions on the World Health Assembly. Good luck for the rest of the day, for the rest of the agenda. And thank you again for being here. Thank you.
Thank you so much for having me. Have a good day.
Thanks. Same to you. Okay.
Just,
Yeah. You want to add something? Yeah.
just to add that we have today, for those of you who are interested, a press briefing at 2 o'clock on hantavirus and Ebola.
very much for that, that housekeeping. That's good. Excellent. Thank you very much again, Sigrid. Christian, yeah, real quick, yeah.
Very quick one to Tarek. There's a strategic meeting today on Ebola. Is that correct? Can you tell us something about that? You know, it's been going around that there's an important meeting today, and I wonder what it is. I haven't been able to find out, and when and whether that's an outcome that will be discussed at 2:00.
I'm sure it will, but it's not. It's not a strategic meeting. It is a member state information session, because member states have been requesting information, like a few weeks ago on hantavirus, and then Ebola came. So now also on Ebola and the outcome of the emergency committee, the recommendations that are coming out of that, all of which will be touched at the member state briefing. And then subsequently, you're going to have the press conference where those results or the discussions will be reported, I am sure. So.
And as you know, the Ebola is on the agenda later on for this briefing, but thank you very much for that update again. Okay, I'll call our next guest to the podium. And we have also with us, thank you for joining us here, two distinguished speakers who you might know. On my right, of course, is Dr. Van der Riet, who we've connected with you online. And it's nice to see you in person. And Dr. Akihiro Saita of UNRWA. So thank you both for being here. We're going to maybe start off with Dr. Saita, and then he's going to talk about the health annual report in the area of UNRWA, and then over to you, René, for the health situation in Gaza. So we'll do the presentation together, and then questions for both afterwards.
Yeah. Thank you very much. My name is UNRWA. I'm a director of health of UNRWA. And then I'd like to share key findings from the UNRWA annual report, which will be issued later of the week or next week. I really thank you for organizing this, because the situation in Palestine, as well as neighboring countries, is getting worse. It's not getting better. And I think the world should realize that how the situation is getting worse in Gaza, West Bank, Lebanon, Syria, and to some extent Jordan. But I really want to start with a simple fact. UNRWA is still there. UNRWA still operates in Gaza and the West Bank, Lebanon, and Syria. Last year, UNRWA took care of the 4.5 million medical consultation in Gaza, which is 40% of the entire consultation in Gaza. That's tremendous, because the whole that the UNRWA lost 391 staff in the war, including 20 health staff, which I know some of them. So under such a tremendous pressure, UNRWA continued to operate. That shows the basic fundamental strengths of UNRWA, which will be explained in the annual report. I just want to share some numbers, but going to the points. So for example, total medical consultation in UNRWA last year is 9 million. It's huge. It's like one country. And they took care of that 43,000 pregnant women, 220,000 people with diabetes, hypertension, and the vaccination coverage is 97%. So it's a tremendous support to the, and also important to say that a tremendous contribution to the stability of the region. And it also indicates that UNRWA is a very good public health platform for the country to use to support the Palestinian refugees and the host countries as well. And in Gaza, nutrition survey with the MUAC, 160,000. So its number is huge, and the contribution is huge. And this is a reflection of the commitment of our staff in all the fields. In health, we have 3,000 staff, all in all 25,000 staff supporting this UNRWA operations in all the 5 fields. And with the innovations. In UNRWA, that we started telemedicine because of the limited access, particularly in Gaza, and then other places. So last year, out of 9 million, almost 1 million are done telemedicine by using WhatsApp, social network, and doctors outside place communicating with this one. But the overall, is it getting better? I just want to be honest every year. It's not. The overall situation is extraordinarily horrible. And then the Gaza, there's still that after the so-called ceasefire, people killed, and the goods are not going in. And thanks to the partners that we have around the 60 to 70% of the medicines available, but still it's not the full. And because of the Knesset bills against UNRWA, we are not able to bring the medicines inside Gaza and the West Bank. And also that we lost 2 health centers in the East Jerusalem early this year. Jerusalem Health Center and the Shohat, which covers around 11,000 patients every year. So we're trying to follow up where they are. And at the same time, UNRWA's financial crisis is serious. From the beginning of the February this year, we cut the staff salary by 20%, by working 20%, working hours by 20%. And so, for example, in the West Bank, we work 5 days, used to work 5 days, now it's only 4 days. And then in Gaza, they continue to work 6 days, but less working hours. This is a tremendous pressure for the population we serve, and I really appreciate it for the international community continue to support UNRWA to go back to the 100%. And then, of course, in Gaza, goods are not going in, life remains horrible, and many of our staff still live in tents. And one of the staff told me, which I never forget, that they say that I feel like I become an orphan of the world. No one's taking care of us. They forgot us. That we should prevent this. And so that my last part is appeal to the international community. UNRWA is in Gaza, say, for example, covering 40% of medical consultation, which is a tremendous public health platform. And we're ready to remain, and all the partners are ready to use our services to hopefully go into reconstruction, recovery of the health services. Same for the West Bank. Because of incursion, we lost some of the camps, but we still maintain our services. And UNRWA is an extraordinarily good asset to the international community to contribute to the health game, but also importantly, regional stability. And I really appreciate your continued support. Thank you very much. 5 minutes.
Thank you very much. And just as we've said here repeatedly, UNRWA is indeed the backbone,
Yes.
and it provides absolutely vital services. So thank you very much
you.
for sharing this update. Renee, over to you.
Thank you. So indeed, I'm Renee van der Weerde. I'm the new WHO representative for the occupied Palestinian territory. Et je suis ravie d'être avec vous aussi ici en personne. Just before I start, to say that UNRWA was created for a specific purpose, to address specific needs, and unfortunately these needs are still there. Nobody can replace what UNRWA is doing. So I am here in person this week because I'm attending the World Health Assembly in person. The World Health Assembly is interesting. It has a dedicated standing mandated agenda item on the health of the people in the occupied Palestinian territories, East Jerusalem and occupied Golan. So that's why we're here. That dedicated specific agenda item has been there for decades. So it's not something that has been new, but you can imagine with the recent conflict and the devastating images that you've all seen and that you all show that the attention around these specific discussions really attract a lot of attention. Seta, you didn't mention it earlier this week. We also had an amazing, if that's the right word, side event. A side event that is an annual event organized by The Lancet, which had held in person, UNRWA, the Palestinian Ministry of Health, and very interestingly, the International Federation of the Medical Students Association. Something myself, I had underestimated how many students have passed away during this conflict. It's very heartening to hear medical students that were killed, those that wanted to become doctors, nurses, physiotherapists, to be the future of Palestine, to look after their own communities. The numbers are just staggering, and it was a very emotional event. That event is always very, very well attended, despite the many competing side events at the margins of the World Health Assembly. And so we really welcome this attention, support, and solidarity to the health of the Palestinian people. It's very encouraging, but we also know, especially in these days, that attention is an increasingly scarce resource. There is so many crises, just looking at what you will be addressing today, that the news from Palestine, however devastating it might be, that it's just competing with ever shrinking attention span. So I really wanted to thank you, all of you here in the room and online. This press course really plays a very meaningful role in ensuring Palestine does not fade from public consciousness. Consistent, credible, evidence-based reporting on what is happening in the occupied Palestinian territory matters. And for that reason, we ask you to keep the attention up. And I really want to thank you on behalf of my organization, on behalf of the Palestinian people, and on behalf of all the humanitarian workers in Gaza. Never forget that our national colleagues cannot leave Gaza. So the fact that I'm here talking on their behalf and that they will hear and see through your outlets what we are reporting is very, very important. But unfortunately, as you said as well, week after week, we hear the same thing. Oh, the situation in Gaza, West Bank, and in East Jerusalem, it's bad. And it is. I was in Gaza earlier this month, only my second time, and it's just, there are no words. I've been doing this for 30 years. Started with Médecins Sans Frontières in Grozny in the First War. I was based in Somalia, Mogadishu, before coming here. You think you are prepared, but nothing prepares you for Gaza. And I thought going in the second time would make things easier, but it just doesn't. It just doesn't. And as you rightly say, despite the ceasefire of last October, there is perhaps less fire, but the violence continues. We hear bombs nearby. There is gunfire every day. And we'll make sure that you get the reports from the UN Department of Safety and Security, that you can see the trends. It's tense in Gaza as we speak. The yellow line has moved again. That means today more than 2 million people live on less than half of what the Gaza Strip was before this war. And that yellow line is dangerous. When I left Gaza the first time, they shot at a taxi driver that was transporting 2 of my colleagues. That taxi driver was killed. My 2 colleagues, young medical doctors that were on their way to Rafah to support medical evacuations, they are not okay. And their numbers don't appear. So despite this ceasefire, at least 880 people have been killed. That's October last year. More than 2,600 people have been injured. And as you all very well know, WHO, we have a World Assembly Resolution number 65.2, where we are asked on behalf of our member states to document attacks on health. And only this year, we have reported 22 attacks on healthcare in Gaza. 5 people died and 18 people are injured. Only 53% of the hospitals in Gaza, we reported that last time. Actually, not one of them is fully functional. And one of the key reasons these facilities are not functioning is because they're struggling with critical shortages of medical supplies. And that is perhaps something I wanted to focus on today, because the amazing health workers in Gaza, they are the most amazing people you ever meet in your life. They deserve to have access to the medicines and the medical supplies that they need to do their job. Their job is to save life, look after the injured, look after the people that are sick. And just let me be specific with some of the examples of what is currently not entering Gaza. In Jordan, there is a prefabricated hospital waiting for months to enter Gaza. Laboratory equipment, reagents, oxygen concentrators, orthopedic items, not luxury items. These are essential items. These are essential items that are needed to make health facilities and the health system work. And without laboratory equipment and reagents, we cannot diagnose diseases and detect potential disease outbreaks. We're talking about hantavirus, we're talking about Ebola virus. This is not luxury. This is equipment that we need to save lives, to detect diseases, to alert the world about potential outbreaks and make sure that people don't die. And you can only imagine with the horrific living conditions, overcrowding, rodents, lack of water and sanitation, that this is urgently needed. Because without these delays in diagnostic, we don't know the threats coming. Without oxygen concentrators, let's just be honest, that is critically ill patients that die. And without orthopedic supplies, surgeons cannot properly treat injuries. Some of these supplies that are not entered, you might have heard about it, Israel calls them dual use. Israel has a specific legislation that talks about dual use. This is not dual use. Essential medicines, WHO has internationally recognized lists of essential medicines. That is what we are talking about. So we really want you to help change that narrative about dual use. Essential medicines, essential supplies are essential medicines and essential supplies. There should be no restrictions. There should be no bureaucratic processes and access restrictions on that. And by doing so, let's just all make sure that health is protected and that humanitarian access in Gaza is unrestricted. And thank you again for thank you again for really keeping the Palestinians' health on the respective agendas. Thank you.
Thank you very much, Renee, for that very moving and very immensely important brief, and to you, Saito-san. So let's start off with questions, starting with you, Christiane, from German News Agency. Thank you.
Thank you very much for being here. It's wonderful to see you in person. I was going to ask you a question exactly about these essential medicines. We had a briefing 2 or 3 days ago from the Israeli government who said exactly that. They cannot provide generators or oxygen machines because the pipes will be misused by Hamas and turned into rocket launchers. Do you see that in your work in the Gaza Strip? Do you see that Hamas is interfering in deliveries that you are trying to bring in? Is there a grain of understanding? Is there concern that there might be some diversion of stuff that is coming in that might be used? I'm not talking about obviously the essential medicines, but generators, for example, or machines that you want to use, of course, to treat patients. Is there a concern that Hamas is somehow controlling or interfering in the process of delivery? Thank you.
Thank you. So we bring in WHO, and we want to thank a lot of the member states that support us. We bring in supplies on behalf of also now UNRWA, with all the restrictions on UNRWA. So we bring in medical supplies, not just for WHO, for the Ministry of Health, for UNRWA, and a lot of health cluster partners. They go to WHO warehouses. For the generators, for example, now, because Israel has asked us to track and to monitor, there are trackers on generators. And medical supplies, sometimes you wonder what you can do. I think when you look at it, and everything can be used for other purposes. We have been talking about stents. For all of you that know what stents is, so we have the stent machines and the cardiological surgeons in Gaza, but the stents, which is like the stapler, you have the stapler, but not the stapler. You have the stapling machine, but not the stapler, can't go in. We have made promises to the Israeli authorities that we will make sure that items will be installed, especially big items. There are drones over Gaza. At night, you don't sleep okay because you have drones over Gaza. So the big items, we've made all the promises and the commitment that we will be trackers on there. We don't get in armored vehicles, even following that critical deadly incident. The armored vehicles that WHO needs to do our job are not coming in. The spare parts for armored vehicles are not coming in. The spare parts for generators are not coming in. Oxygen generators are not coming in. And laboratory equipment is not coming in. We had discussions about centrifuge, explaining what a centrifuge was and why you needed to do very basic medical analysis. So we want you to help change that narrative. And we're not talking on behalf of the other UN agencies. Cement, I often say when I go to Gaza, I should not have studied medicine, I should have studied civil engineering. You know more about spare parts and cement. All these things can't go in. So how can we even start thinking about rebuilding health and health facilities in Gaza when we can't bring in laboratory equipment? Thank you.
Two things quick. Firstly, until last January, we could bring our medicine by ourselves and the other medical equipment. And like with WHO, we have a good logistics system recording where they are, when to when, and so that we know exactly where it was delivered and used, and so that we can prove that we can show where the goods are. And so that's same for WHO at present. And secondly, this laboratory, as I said, we are treating a diabetes hypertension patient without laboratory test. And so it's very difficult to see if diabetes control or not. And then new cases of diabetes, we have to do laboratory tests. So the incoming of the new patient is very limited because we simply can't diagnose. And so that is diabetes, once you do that test, it's a life-saving. We have medicines, we have a treatment, but if we cannot do this, we are treating patient without knowing exactly what's going on.
Thank you both very much. Okay. Yes, Olivia, Reuters.
Good morning. Thanks very much to both of you for your briefings. Just to check on, sorry, just a quick question on the UNRWA report. Just check your comments. Are they under embargo, or can we use them already, given that the report is coming out? And then I have a second question for the WHO.
Sorry, it is not issued yet, and so that once it is issued, that the UN will send to everybody. Sorry, it's a bit delayed, but and with this new report, it has all the statistics. Yeah.
Thank you. And just second question, you were mentioning there, for example, about just the difficulty with lab testing, diagnostics, and then how you would then control diseases. We did reporting recently on concerns about rats biting people, etc. I was just wondering if there are any other issues currently really high on your kind of agenda of concern. I know there are multiple, but perhaps a recent surge in a disease or virus that is causing a concern, given obviously the ongoing very poor sanitary conditions in the enclave. Thank you.
Sure. So we see both spectra. We see communicable diseases. So we have indeed seen a significant increase in what we call ectoparasitic diseases, which is things just from very poor living conditions, lack of access to water. We've seen an increase in respiratory infections, and we, of course, very, very concerned about waterborne diseases. There are increases in acute watery diarrhea, but again, to make sure that acute watery diarrhea is not something that we would be extremely concerned about, we need testing. A success story has been on polio, as many of you might have known. So we've been successful to vaccinate together with UNICEF, UNRWA, and many partners, loads of children against polio. So we do hope that that will be under control. But then on the other side, you have the non-communicable diseases, and you just have so many people suffering from trauma. One of the important issues that we're trying to address is a lot of people that have had amputations. And in the last report, you saw just 5,000 people with amputations. For them to get their prosthetic limbs, which is also, by the way, a dual-use item considered by Israel. But for someone who has had an amputation, they need corrective surgery to make sure that that limb can be fitted appropriately. And that surgery for the moment can't take place in Gaza. So these unfortunate people need them to be on a waiting list to leave. And then one thing I didn't want to touch about today, but that we definitely look forward to briefing about, is mental health. It's more than 1 million people with severe mental health issues. And when I look at myself and everybody that has been in Gaza, you can only imagine the burden. And this is for generations to come. So we really need to keep an eye on both the risks of communicable diseases that are spreading, given these living conditions, and then just making sure that the non-communicable diseases, the diabetes, the hypertension, the trauma, and the mental health is addressed with a very, very, very constrained health system.
I think, Saito-san, you wanted to add something, and then maybe back to you for a follow-up. Sorry.
Yeah, thank you. Yeah, this is exactly what Rennie said, that when I saw the rodents increase, I felt this is a collapse of society. It's not the collapse of the building, collapse of the water, it's entire society is collapsing, because otherwise the rodents want to increase. The lack of reconstruction, lack of cleaning, lack of many wash activities, and it resulted in the increase of rodents and then skin infection. And it reminded me that the last summer, in summer that IPC announced the famine in the Gaza city. And this is not simply shortage of food. It's a society collapse because it's not famine in that scale will not happen simply shortage of food. It's the lack of the water, lack of the good cleaning housing, and also the lack of medical supplies and equipment. Because that if the kids got infected, then that become less immunity and they become more prone to that malnutrition, and so that the same thing is happening. So I felt very sad when I saw the rodent increase. That the Gaza reconstruction is actually not happening, but again that we saw the consequence of a collapse of the society.
Very important point. Thank you so much. Olivia, please, back to you.
And sorry, forgive me, my follow-up was just, I also forgot to ask something that really struck me from what you said is, this question about reconstruction. Where is the WHO at exactly now in terms of, also UNRWA, bear in mind that you're still facing just, as you said, surge of spread of disease, trauma patients who need to have, masses of corrective surgery, etc. The list is extremely long in a setting whereby healthcare is still on its knees. I was just wondering, is the WHO or UNRWA, are you looking to launch anything soon in terms of trying to get kind of projects off the ground to try and start rebuilding, be it hospitals or healthcare clinics, or is that still too far away? And how does that work also with the Board of Peace, which I'm still a bit confused about what is happening, what the coordination is there? Thank you.
Yes, thanks. Last time we mentioned, if you haven't seen it, the rapid damages needs assessment, which was done as part WHO together with the UN, the World Bank and the European Union, and that calls out the level of destruction is estimated at 1.4 billion and the needs over several years. So it gives you the scope of what needs to happen. If we can't get in a sack of cement today, I think we also not be naive and fool ourselves. But your point is very important. You need governance to start talking about reconstruction and recovery. And under the ceasefire and the Board of Peace, there is indeed the NCAC, the National Committee to administer Gaza, but they unfortunately still in Egypt. So for us to have really impactful discussions on what does recovery and rehabilitation reconstruction look like, the government needs to be in place. As WHO, we have supported the technical part. So we have developed together with experts the blueprint of what a new health system for Gaza should look like. For example, less hospitals, but better hospitals. So the blueprint is ready. The people are ready. The governance need to be put in place. And I'm sure other people can come here one day and tell you about the Board of Peace and NCAC and how we as the UN interact with them. But that is where we also kind of in an impasse because the Palestinian Authority in Ramallah is waiting. The health authorities in Gaza are waiting for this new administration to come in and start moving things forward. So it is and I can only imagine, and being a Palestinian living in Gaza, that must be frustrating because that's now 6 months ago that ceasefire was announced.
Do you want to add something?
UNRWA is, I can talk in health. UNRWA is part of the health systems ongoing inside Gaza. And so working closely with WHO and the health cluster, they remain ready whenever reconstruction starts, because we have the largest public health platform. So we work with the partners to contribute to this. Yeah.
Both again. Okay, yeah, Mohammed. Anadolu.
Thank you so much. My question for WHO. Madam, thank you for being in Geneva and for this press briefing. I would like to ask you the situation in Gaza in terms of medical evacuation. How many patients have been evacuated since the beginning of the ceasefire, and which borders you are able to use for these operations? Thank you.
Great. Yes, so medical evacuations, they remain an important part. Very complex and extremely dangerous. So far, we've been able to support the Ministry of Health in evacuating approximately 12,000 patients, and more than 30 countries, many European countries from all over the world have been able to accept these patients. The Rafah crossing is open again since February, and that is a key crossing through which patients can leave then from Gaza going into Egypt. And the other crossing that we use now again up to once a week is through Kerem Shalom, from where patients can then go through a very long and complicated pathway to Jordan. We just need to make sure that when we talk about medical evacuations, that we also make sure that we understand how difficult this is for these patients and their families. Often only one or two family members can leave, and conditions for return are not always there. So that's why, of course, as WHO, we keep advocating for medical evacuations for very specialized cases, but we also want to make sure that an increasing number of the thousands and thousands of people that need specialized care in Gaza today, that they can be treated in Gaza. The example I gave earlier about someone who has his limb amputated, who needs reconstructive surgery so that he or she can have a prosthetic, that should be able to be done in Gaza, especially with emergency medical teams. We have specialized emergency medical teams that can come in. Unfortunately, they often face the same constraint of not having the medical supplies. And that is extremely frustrating for them, because they do enter a very active, dangerous place, to then be faced with situations for which, again, the supply side of them not being able to do complicated orthopedic or corrective surgery is happening. So yes, medical evacuations need to continue. We thank all the countries that support us, but we really want to start making sure that the people that can be treated should be treated in Gaza. And the final point on which we do hope to make progress is the referral pathway of Gaza to hospitals in the West Bank and East Jerusalem. Before this conflict, this is how this would go. Patients from Gaza would then be able to go to East Jerusalem and the West Bank, which is much easier for them also socially. Often they could go back and forth, especially patients suffering from cancer. They could go in for their treatment in hospitals in the West Bank, go back to Gaza, recuperate with their family, and then go back. So from a dignity point of view, from a patient care point of view, that is really what we want to stress with all those involved. Thanks.
Absolutely. Okay, we'll have a few questions online still. Start off with Musa Al-Mayadeen. Musa, allez-y.
Oui, merci beaucoup. I have a question for UNRWA, please, concerning the situation of Palestinian refugee camps in south of Lebanon. If you can give us some details about the situation in these camps. Une question pour WHO, puisque vous avez visité Gaza, vous avez parlé tout à l'heure de la ligne jaune qui se rétrécit. Et je voudrais savoir, si j'ai bien compris, que tous les Palestiniens maintenant vivent dans la moitié ou même moins de la moitié de la bande de Gaza. Qu'est-ce qui se passe exactement derrière cette ligne jaune? Est-ce que les Palestiniens n'ont pas le droit de s'approcher, de traverser? La situation là-bas, est-ce qu'il y a encore des populations ou il n'y a plus rien, tout est détruit et il n'y a plus personne? Merci beaucoup.
Yeah, thank you. Thank you for the question, because Lebanon is also important for us to focus on this one. And in Lebanon, that the Palestinian refugees camps are affected not only the south, but also south of Lebanon, but also south of Beirut city, which is close to the hot area. And then some of the camps are closed, and then that we're trying to open to these camps inside Beirut as well as south of Lebanon. So it doesn't go smooth as we wished. But one reason is that because of the damage of the bombardment, but also the people have no place to go back. And so that in the particular south of Lebanon, that we are still struggling to open the camps and the health centers. That's what I can tell. Thank you.
Thank you.
Merci beaucoup pour la question sur la ligne jaune. Ce qui s'est passé suite au cessez-les-feux, c'est qu'on avait découpé, si vous voulez, Gaza en deux. Une partie, nous on appelle ça vert, où on peut se déplacer librement, avec le côté rouge, où en fait l'armée israélienne est encore en train de faire des activités militaires. Du coup, et la ligne jaune, si vous voulez, c'est un peu entre les deux, où nous, on y accède. Par exemple, pour aller à Rafah et à Kerem Shalom, on passe du jaune, du vert au jaune, au rouge. Et ça veut dire, pour nous, on doit avoir des voitures blindées, porter des gilets pare-balles, ainsi de suite. Malheureusement, ce n'est pas une ligne visible. Du coup, cette ligne, en fonction de l'activité kinétique militaire qui se passe de l'autre côté, cette ligne bouge. Et ça veut dire, pour certaines populations qui vivent là, ils peuvent se réveiller du jour au lendemain, se retrouver dans une zone très active de la guerre. Et je crois que c'est important que vous le souligniez, il y a encore beaucoup de combats à Gaza. C'est pas que le cessez-le-feu, c'est maintenant, il n'y a plus de feu dans cette ligne rouge. Et vous l'entendez quand vous êtes à Gaza, vous entendez très clairement les bombardements, les attaques aériennes qui s'y passent. Ce qui est important pour nous, c'est que dans la zone verte, pour nous, on n'a pas besoin de négociations, de coordination avec les autorités israéliennes. Comme humanitaire, dans une ligne verte, je dois pouvoir me déplacer pour faire ce que je dois faire. Dans les lignes jaunes et rouges, je dois négocier, et vous imaginez très bien le temps que ça prend. Et c'est pour ça que les évacuations médicales qui passent via Rafah et Kerem Shalom prennent autant de temps, parce qu'on doit négocier avec les autorités militaires israéliennes pour être sûr que le mouvement, à ce moment-là, il est toujours approuvé. Merci.
Merci à vous. Merci bien. Okay, we still have a couple of questions, so we'll go to Nick, New York Times.
Yeah, good morning. Thank you for the briefing. Couple of questions. You mentioned a prefab hospital waiting in Jordan. What's the current situation of beds? Is there